আমি Dr. Shamik Gope. আমি একজন maxillofacial and head and neck surgeon. I have been operating for last 15 years with my team. I do cure or I try to cure the patients with diseases at face, mouth, jaw and neck. It comprises the maxillofacial and head and neck surgery. Along with other specialties, this is another head neck surgical. The kind of treatments we are providing, let's classify into two forms. One is emergencies and one is planned or elective. In emergencies, we do treat the fractures of face, mouth and jaw and any airway emergencies when the patient comes with difficulty in breathing and apneic states where the emergency life saving is required. With our team as a craniofacial surgeon along with neurosurgery and other specialties, we do present at the site where the patient has been brought. And the elective operations, the planned operations, we do treat the cancers of face, mouth, jaw and neck. Let's discuss about the head and neck cancers. The forms of head and neck cancers comes with some non-healing ulcers at your tongue, cheek, palate, lip or throat, and some tumors with pain in front of your ear at your neck. These are the classical presentations where we can suspect this might be the cardinal signs of head and neck malignancies. In short, and another most classical sign of head and neck malignancies, reduced mouth opening. And all these forms most likely are related to tobacco and tobacco products. Tobacco products comes in three forms. One is chewing, one is smoked tobacco, and another is snuff dipping. And some of the environmental factors are also involved. So let's talk about oral oncology or oral cancers. So in oral cancers, if one of the individuals come to us with a persistent ulcer at his or her tongue, cheek, palate, lip or any part of the mouth including the jaws and tonsils, if the ulcer is there for more than 2 weeks, if the patient is not diabetic or doesn't have any immune compromised state, then the ulcer's healing is getting delayed. So our query is why it is getting delayed. So then and there we do examine the patient. We follow the basic surgical principles of examination, and if we find that the ulcer is non-tender, if it is hard, in our language which is called induration is there, then and there we took a small biopsy to know the nature of the disease. That is the most evident tissue diagnosis, and according to the biopsy report we do wait for the biopsy report to come with the small tissue specimen. Like that, for head and neck cancers, it can come in the form of tumors or swelling. So for those tumors, we take the help of needle biopsy or FNSC to exclude or to predict whether it is malignant or not. And for both the cases of oral oncology as well as the other cancers of head and neck, our radiological friends comes into the picture. To know the extent of the disease, we take the help of CT scan, MRI, and for head and neck malignancies, after our initial examination, we conclude into a provisional diagnosis with our provisional clinical staging, because most of the head and neck cancers can be cured if those can be detected at their initial stages. For head and neck cancers, we do examine along with the site the neck, because most of the head and neck cancers spread through the neck lymph nodes and then up to the distant sites like chest, bone and brain. So in these aspects, we do the total metastatic workout. We do CT chest and CT scan of the neck, and most likely we do MRI of the primary and MRI of the whenever the lesion involves the tongue. So MRI other than CT gives us the proper picture how close is the lesion from the midline. So these aspects will help us to go for the definitive surgical management. And according to our clinical staging and the histopathological grading of the tumor, a tumor board is being organized involving our radiation and medical oncologists, so that it comprises the whole head and neck cancer team. So it has been decided in front of the patients and their relatives that these are the treatment plans according to this stage will be established. Most likely it is evident that most of the head and neck cancers, there is only one form of treatment, that is surgery, and in advanced stages surgery followed by radiation or chemoradiation. And patient will be at follow-up with us, the surgical oncologists, as well as the medical and radiation oncologists for coming 5 years. So it's alarming. Is there any non-healing ulcer at any part of your mouth or any swelling at your neck which is not paining? It is an alarming sign someone may be carrying cancer. So we, the maxillofacial and head and neck specialists, are there to treat you. And at the Samaritan Medical and Surgical Critical Care Center, we do treat all kind of these emergencies as well as the planned head and neck cancer operations with proper reconstructions, so that the soft tissue, hard tissue, as well as the dental rehabilitation can be given to the patient for the overall betterment and quality of life. So please come to us. We are at Samaritan Hospital to serve you. Thank you.